an infection of one or both lungs caused by bacteria, viruses, or fungus is known as pneumonia. Lung air sacs become inflamed as a result of the illness. As the alveoli swell with liquid or pus, breathing becomes challenging. Air sac inflammation in the lung is a result of the immune system's response to eradicate the infection.
During normal respiration, air travels through the nose, down the trachea, and into smaller and smaller airways called bronchi. The bronchi divide into bronchioles and finally into tiny grape-like clusters of thin, fragile sacs called alveoli. Bronchitis is an inflammation of the bronchial tubes or bronchi.
Black lung disease is inflammation and scarring common among people who work in coal mines. Some people may not have symptoms. Others may have difficulty breathing, cough up black mucus and experience chest tightness. Medications can help ease symptoms, but there's no cure.
Did you know that cystic fibrosis, or CF, is a genetic disease that primarily affects the lungs and digestive system? Let's take a quick look at what CF is and how it impacts the body. Cystic fibrosis causes the body to produce thick, sticky mucus instead of thin, slippery mucus. In the lungs, this mucus can clog the airways, making it harder to breathe and leading to frequent infections. In the digestive system, the thick mucus blocks enzymes from reaching the intestines, making it harder to break down food and absorb nutrients. This can lead to malnutrition and other digestive issues. CF is inherited, meaning it's passed down through families, and it's caused by mutations in the CFTR gene. Both parents must carry the gene for the child to have CF. While there's no cure yet, treatments have come a long way. Medications and airway clearance techniques help keep airways clear. Enzyme supplements aid in digestion, and new therapies target the genetic root of the disease, improving life expectancy.
Tuberculosis, or TB, is a bacterial infection that mainly affects the lungs but can spread to other organs. It's caused by Mycobacterium tuberculosis and spreads through the air when someone with active TB coughs, sneezes, or talks. Symptoms of active TB include a persistent cough lasting more than 3 weeks, chest pain, coughing up blood, fatigue, fever, night sweats, and weight loss. But did you know TB can be latent too? In latent TB, the bacteria are inactive, there's no symptoms, and it's not contagious. For diagnosis, doctors use medical history, physical exams, chest x-rays, and lab tests like sputum culture. Treating active TB involves antibiotics for several months, and it's crucial to finish the treatment to avoid resistance. Prevention includes the BCG vaccine, early diagnosis, and infection control in healthcare settings. Stay informed and stay healthy.
Pleural effusion refers to the accumulation of excess fluid in the space between the two layers of the pleura, the thin membrane that surrounds the lungs. This condition can result from various underlying causes including infections, heart failure, cancer, or inflammation. The presence of fluid around the lungs can impair their ability to expand fully during breathing, leading to symptoms such as chest pain, shortness of breath, and coughing. Diagnosis typically involves imaging tests like chest x-rays or CT scans, while treatment depends on addressing the underlying cause and may include medications, drainage procedures, or surgery. Book your appointment today at Vasant Kunj Medical Center.
Classical bat wing appearance is visible as bilateral hilar haze. Cardiogenic pulmonary edema occurs when the pulmonary capillary pressure exceeds 25 millimeters of mercury. Above this level, the plasma oncotic pressure is unable to prevent transudation of fluid into the interstitium. Initially, interstitial pulmonary edema occurs, which manifests clinically as shortness of breath and tachypnea. As it progresses, alveolar edema occurs, which manifests as dyspnea with frothy blood-stained sputum and bilateral basal crepitations. In more advanced stage, the crepitations extend throughout the lung fields.
There are a number of symptoms of lung cancer, but they can also all be caused by much less serious conditions. These symptoms include having a cough that won't go away, or a change in a cough you have had for a long time, being short of breath, coughing up phlegm with signs of blood in it, chest or shoulder pain when breathing or coughing, loss of appetite, or unexplained tiredness or weight loss. If you think you have any of these symptoms, go and see your doctor. If lung cancer is diagnosed at an early stage, treatment is more likely to be successful.
Smoking damages two main parts of your lungs, your airways, causing chronic bronchitis, and small air sacs called alveoli, making it harder for oxygen and carbon dioxide to exchange with your blood. Over time, so little oxygen can reach your blood that you may develop emphysema, a condition in which you must gasp for every breath and wear an oxygen tube under your nose in order to breathe.